complex or more complicated
I
than
guess
it is.
that's what it means by anti-hypertension.
Yes.
Okay, so we sort of like the consistent monitoring to reduce the blood pressure to the levels, and that level is what?
Well, ultimately, the current
Yeah.
studies, this is as of last year, 2003, we want a blood pressure reading 135, less than 135 over 85. So that is our goal. The lower, the better. This is what we want.
Okay, very good. Now, everyone has been very disturbed and maybe sensitive, maybe more aware of their heart as a result of our former President Bill Clinton's not heart attack, but I want you to define the situation, and because many people are making phone calls to the hospitals, they want to get checkups now, which is good, and they're going to their doctor, and they want to know just what is going on. What can we, and I particularly, anyway, and also our viewing audience do to prevent that from happening to us?
Right.
And that wasn't a heart attack, so you want to explain just what it was.
Okay. Well, first and foremost, you must be proactive with your health. We are consumers, and the product is our health. So you have to be proactive. It's just like if you're going to buy a product in a store, you become educated, and you do cross-references, and you do compare pricing. Well, we don't have that option to compare prices. We only have one body, one life. So we have to go out and be proactive, do a complete history and physical, and do, depending on your age, an EKG and get a baseline. Let's define heart attack. A heart attack is a layman's term. We, in the medical profession, we say myocardial infarction, or an MIA, myocardial infarction. That's an MI, excuse me, an MI, that's the abbreviation. What that means is lack of oxygen, lack of blood flow, lack of oxygen to the tissue of the heart tissue dies, and that's where you get that pain, because you have ischemia, lack of oxygen, blood flow to the heart tissue. We have also what's known as coronary artery disease. Coronary artery disease. We discussed this in previous lectures or presentations, where you have hardening of the arteries. I mentioned that also, or you have plaque formation building up in the arteries that surround the heart. That will lead to the lack of blood flow, ischemic event, or heart attack. What happens here is you start to have this dull, achy, pressure feeling around the heart. It could also be called angina. We have stable angina and unstable angina. I'm not going to define that because that would be another topic.
Right.
But you have lack of, again, oxygenation to the blood. You might have a shortness of breath, or you might have pain when you're walking, what we call dyspnea, or shortness of breath with exertion, or walking up a staircase, walking from your office down the hallway, or walking from your bedroom down the stairs or up the staircase to your bedroom. What happens is we have this plaque formation building up in the arteries around the heart. We start to have decreased blood flow to the tissue. Eventually, the arteries become occluded, where you have no blood flow, and you have the ischemic event, the so-called heart attack or myocardial infarction. With this
so
case,
basically, that's what the president had. He had a mild.
well,
What would
he's having blockage of the arteries surrounding the heart.
Right, that's what we just talked about.
Right, so he was having the plaque formation or the fat building up. Again, let's use the term fat. He was having fat build up in the arteries, which is extremely common.
Right.
And in order to correct that, there's two techniques. There's a few techniques. We do a real conservative with diet modification, weight reduction, and we have fat blocking medications. But that's the first line. But when your arteries are blocked, they're not going to help. You have to be much more aggressive. We do what you heard the term stent placement, or angiography, or angioplasty. And that's where they go in and they send a wire into your heart, and then they use a balloon and open up the arteries, and then put a splint in there to help maintain the arteries. That's a good procedure. However, it only lasts for about a year.
So what are we saying to the folk right now? If you're concerned, what should they do? And then we're going to go into answering the question that many people have been asking about. How do we get to Dr. Tommy O?
Okay.
Okay, but tell us, what should a person do right now
Okay.
if they're concerned?
Yeah, if you're concerned, again, be proactive. Go to your physician, an annual history and physical, and do a thorough one. If you're having any sensation in your chest, do a baseline EKG. If you're not sure, if you're over the age of 50 years old, ask your doctor to do an EKG. If there's a family history of heart disease, even if you're less than 50, do a baseline EKG.
Now, how do we get a hold of Dr. Tommy O? Where are you located? And they're going to come up on the screen, but we can give the name of the medical center because they're doing a great job. They just opened up a new facility, folk, and you're going to see those addresses on the screen. But how can we reach you?
Okay. Well, I am located at 2 offices, both located in the Bronx.
In the Bronx. Mm-hmm.
The first office will be the South Bronx. That's 423 138th Street between Willis and Brook Avenue. It's a large multi-specialty facility. It's about 30,000 square feet. We have all different disciplines in there. All you need to do is call up. There's a number on the screen and set up an appointment, and I'll get you in. I'll be more than happy. I'd love to have you, and that's why we're here. I'm here for this show. We're here to offer you this knowledge. Come and see me. The second office we have is in the north side of the Bronx, and that's what we call 238th Street, but that's not the...
That's in the area.
It's just an area location. It's located on 4377 Bronx Boulevard, just north of 233rd Street. It's on the west side of the street, right across from a Hess gas station.
Actually,
that's their landmark.
They get that all the information on the screen.
Yes.
And well, we come to the close of this. Boy, it's just so much information to get over to the people. We want to thank Jeanette for doing an excellent job. Am I correct? That's the right? Yeah. Villanueva?
Yes.
I got that right. I did better than the doctor too, by the way. And well, folks, we want to make sure that you get this information. All Med has medical and rehabilitation center, just doing a fantastic job. If you go there, you'll find a real welcome and from people who are concerned about caring for you. And certainly you will find Dr. Tommy O there. There are certain days that he's in certain offices and other days at different offices. So you have to call in advance and make an appointment. But I want you to know that you will be welcome at All Med. We come to the close of this, and we want you to know that you can email us. Now, the email address for Church Alive is coming up, and we want to hear from you. Whether you like the show, what we could do, it may be subjects that we haven't covered that you'd like us to cover. Maybe we haven't covered it in as broad a scale as you would like. So you write, email us, tell us what you like, tell us what you didn't like. Maybe you don't like to shine on Dr. Burkett. I don't know. But if you can help me with how to get this oil problem of my skin so I can look good for you, then we'd like to hear from that too. And certainly we would like to know that you are taking care of God's temple. That's the body of Christ that you have every day with you. Thank you. Until next time, this is yours, Dr. Burkett, saying we love you with the love of the Lord.
Love.